We welcome you back to our Tuesday program here on Channel 6. And of course, our program today brought to us by the Saddleback Memorial Foundation. Lots of good things available over at Saddleback Memorial Medical Center. Lots of great folks working over there to keep everybody healthy and well here in our community and in the surrounding communities as well. Joining us today is Marcy Smith, who's a nurse practitioner, and she's what's known as a breast cancer navigator over there at the hospital. And we welcome you to our program today.
Thank you.
Obviously, that's about the scariest news most people can get, is to be told by their doctor or somebody that they have cancer. Especially frightening for women with possibilities of surgery, the effects of radiation, chemotherapy, scary time. Am I going to survive? Will I live? Will I be able to see my grandkids grow up? All these questions come to their mind, I'm sure. Talk a bit about the background of this program, the Navigator program, how it was set up.
Well, the breast center has been at Saddleback for over 20 years. It's the first breast center that was established in Orange County. And from the very beginning, the hospital felt that it was important to have nursing staff there to help patients navigate through that difficult time that you speak of. Patients hear the word cancer, and certainly they feel like it might be a death threat. Right. And actually with breast cancer these days, it's an extremely treatable disease, and patients have to understand that we have great treatment, and how do you get to that treatment? How do you get to the doctors? How do you get help with the financial issues and the social service issues that we have at the hospital and in the community?
Right. I know part of the program is having someone such as yourself really sit down with the patient, explain things to them. And we all know how busy our doctors are these days, and sometimes they try to give us as much time as they can, but obviously with the hundreds of patients they see and the requirements, they really can't give us a lot of explanation. So that's where you and folks like you come in. You can only take the time to sit down with that person and explain to them the testing procedure and then the treatment procedures.
And also just the wording of their diagnosis. What does those words actually mean, and what do I need to take care of that diagnosis and that. So I think we have busy physicians, but we also have a lot of information overload out there on the internet, and how much of that information applies to me and the situation that I'm in, and that so that we can sit and help sort them through that, and then, like I said, get them to the appropriate care that they need for the treatment.
And part of the process along the way is they will be dealing with lots of individuals. Correct. Probably their primary care physician, who may be referred to them. Maybe they discovered a lump in an exam, or the person discovered a lump in self-exam. They get sent to somebody, a technician who does the mammogram. That gets read by an oncologist. The oncologist sends back a report, and either they talk to the patient, or somebody else does, or you do. And then the discussion of treatment, and that could be, again, a team approach with lots of different folks and specialties.
And it is important to have that team approach and all those different specialists there, because they all provide something to that patient. And what we try to do with any patient that's diagnosed at Saddleback is to have what we call a pre-treatment planning conference, where all those specialists come into the room every Thursday morning and discuss those breast cancer patients. So each patient's case is presented before those specialists. All those doctors that are treating that patient usually are attending that conference every Thursday morning, and we come up with a plan even before the patient goes into treatment.
I know there's lots of options available as well, and it used to always be major surgery followed by massive doses of radiation and chemotherapy. Doctors today try to be as conservative as possible, preserve as much tissue as possible, and if that's not possible, reconstruction has also become very much the norm now for breast cancer surgeries.
Well, I think that's what women have to realize, that there are many options out there. Years ago, when I first started, we didn't have that many options, and most patients were just facing a mastectomy, massive surgery or whatever in that. And now, having the information that they have options, we don't feel like in many of these cases it's an emergency to rush someone off to surgery. We feel it's so important for them to have the information, to feel comfortable with their team of doctors, and then go forward with their treatment, because this is a long-term relationship that they're going to have with these doctors.
Obviously, the first question is, am I going to survive this? And the good news is cancer as scary as the word is very survivable.
It's actually, in some cases, looked at as a chronic disease, and that these, we're going to be living to be 100, maybe some of us, and we may have 2 and 3 cancers in our lifetime. So they're actually very treatable. Cancer doesn't have to be that scary word. Many patients live with heart disease and diabetes, and so can patients live with cancer.
Things that people died from 50, 60, 100
Correct.
years ago, people
Correct.
are surviving today and living good, long, normal, healthy
Correct.
lives. You do about 30,000 mammograms a year over there at Saddleback, which is a huge number. Very good that people are getting those checked. Of that number, rather very few come up with cancer, about 300 out of that 30,000.
Only 300 really do, and that's what patients, I think that they're really frightened to come in and have their mammograms because there is this fear that they are going to be diagnosed with cancer, and the majority of patients aren't diagnosed with
Right.
cancer. But the key here is to find it at an early stage and be
Yeah.
able to preserve that patient's breast and that patient's life. So if we can get that message out to, come in, get your mammogram, and if we can find cancers like a grain of salt.
Another aspect of it is obviously the psychological, the counseling aspect, and that's certainly part of the social services that you have over there, but also the aspect of the cost. And we're hearing so much today about health insurance and all the different proposals and concepts and ideas. And obviously any kind of medical procedure, and with a team approach, certainly you're dealing with lots of specialists. All those technicians have to get paid, the hospital has to get its costs covered. So there's obviously a financial component as well.
And I think that's what navigators are doing. They're looking at that, helping patients get them to the appropriate counselors, financial counselors, grants that might be available out there in the community for patients. There are grants. We work with the Susan Komen Foundation and that to help our patients. So we're there to help them sort through that and see if we can't be of assistance.
Recently, of course, they had the big Race for the Cure down in
Correct.
Newport Beach, and one of the factors they've done is they've actually set up a special fund for people that want to specifically raise a specific amount of money, which covers the cost of a mammogram for somebody who can't afford one.
Correct.
So that takes away the excuse, well, I can't afford to get one because I don't have the money for it. So there's some scholarships available, and those are being available
Right,
around the
and
county.
every month we get information from that organization about where free screening mammograms are being held in the community. So those resources are available.
Great. Lots of good information, lots of good activities coming your way from the hospital over there. How many folks would be like you in the same program? Are you it? Are you the navigator?
I'm the navigator for breast cancer, but there are other navigators in our system. We have a cancer navigator, so for other cancers, pancreatic, lung cancer and that, we have that position. And, navigator is kind of a new term these days, and that so many diseases and organizations are being handled by navigators. For stroke, for heart disease, you'll hear that word a lot.
Obviously, with your background as a nurse practitioner as well, you're able to understand the medical terminology when the doctors throw out these big, long Latin words at us. You're able to translate that into language the average person can understand, explain to the patient and the family. And the family's got to be a component as well, as part of the treatment as well.
Absolutely, and I think those words are scary to patients, but if you can break down those words of that diagnosis and show them a diagram of the breast and show them where so they can kind of visualize how this cancer got started and where it may travel to and why we don't want it to travel to that area and how we can stop it, I think that's important to understand those words.
And obviously you explain the treatment options and side effects that could happen after that. And not everybody gets the same level of treatment. So it's all individualized based on the person. And again, we're finding today doctors are much more conservative. They do the minimum amount of surgery, the minimum amount of chemotherapy, the minimum amount of radiation to take the cancer away, but preserve the rest of the person's health.
Right, and I always tell patients, I've been doing this for 20 years and I haven't seen the same person or another person with the same disease in the same area at the same age. So it has to be really tailored to that unique individual.
Right. Well, obviously the good news is breast cancer and all types of cancer are very treatable when caught early.
Absolutely.
And that's what good testing does over there at the hospital and through our doctors as well. Marcy, thank you so much for joining us today.
Thank you for having me.
Good to have you on the program today. Marcy Smith, who is the breast cancer navigator over there at Saddleback Memorial Medical Center, one of the unique programs at our local community hospital right here for you in our area. We'll be right back with more after this.
The civic-minded citizens and physicians who planned Saddleback Hospital envisioned a full-service, high-tech hospital.
The medical center is a state-of-the-art facility that continually upgrades to remain state-of-the-art.
Our success is a highly skilled, diverse, and caring staff who meets all of your healthcare needs.
We represent virtually all medical specialties, and we practice in close proximity to you, our patients.
Saddleback Memorial Medical Center, keeping the village healthy since 1974.